Good afternoon, everyone, and thank you for joining us today for our 1 p.m. press conference. Today, we will have a briefing from Public Health, followed by some comments from Chairman Christopher Cohilas, and then we'll move to an update from Phoebe Putney Memorial Hospital. Mr. Scott Steiner is here. I'll be bringing him up for some remarks and some updates. And then we'll have Dr. Kitchen will come up and talk for a bit, and then also Dr. Black is here as well, and we'll be going to him as well for our Phoebe Putney updates. And at the end, we'll have an opportunity for any questions you may have. Today, Dr. Ruiz will not be able to remain after his comments. He needs to step away for another meeting. However, comments will be noted or questions will be noted, and we'll be sure to get those to Dr. Ruiz for follow-up questions that you may have. So at this time, I'd like to bring up Dr. Charles Ruiz for our public health update. Dr. Ruiz.
Thank you, Chief. Well, we continue to deal with the challenge of COVID-19, and I know we're all concerned about it. But it's also good, I think, to consider some of the good news. The vast majority of people who are infected with COVID-19 virus are not going to have any major health problems. The vast majority of people will not need to be hospitalized. Of those in that small subset that will need to be hospitalized, most of them are going to make a complete recovery. As the days go by, we learn of new confirmed cases, but we also learn of more and more cases of people who have made a complete recovery. We are seeing more cases due in part because we are testing more people. And so just as we had predicted a week or so ago, as testing expands, we know that we're going to see more cases. That does not in itself mean that things are getting worse, but we are seeing more cases because of the testing. Testing patients helps us to determine, to get a track on where the virus has been and where it might be going through the community, and it helps us to more readily identify people perhaps who need to be isolated, and we therefore can identify those who have been exposed as well. Going forward, we will be doing more testing in the community. I suspect Dr. Kitchen may touch on that from the Phoebe standpoint. In public health, we placed orders last week for the supplies that we need to collect the specimens, and those have not arrived yet. We're hoping they will be here any day now, and when we receive those supplies, public health will also be involved in collecting the specimens that we will then send off for testing. At this point, I'm not able to say exactly when that will begin. Tentatively, we plan to do this at the Dougherty County Health Department. We don't know when or exactly what the hours will be. We don't know exactly what the process will be for people being pre-approved for this testing. Because the supply of materials we expect will be limited for a considerable amount of time, we plan to use those supplies where we believe it'll do the most good. And it's important, I think, to reiterate that testing asymptomatic people has a very limited value. Now, one of the reasons is because if we gather a specimen today, we are not going to know that result for several days down the road. And when it comes back, even if it comes back negative, all we can tell you is that a few days ago, you did not have the disease. While we would all find that comforting, I'm sure, to know right now that we don't have the disease, if that information comes several days later, it really doesn't have that much value. If the testing supplies or if the collection supplies were of unlimited quantity, it wouldn't be an issue. We would be happy to test people at will. For our main message now is very similar to what we've said in the past few days. Sick people need to stay home. given the choice, we need to all avoid sick people. That's not true if we're caregivers, of course. But if sick people will stay home, and if the rest of us will try to avoid those folks, it will help curtail the spread of the virus. We do want the community, though, to exercise compassion and recognize that when we're asking sick people to stay home and isolate themselves, they're going to need help with obtaining groceries, prescription drugs, and other supplies. So let's not forget about our friends and neighbors and family members who might have been asked to quarantine or to isolate themselves at home. They're going to need some support from us. But let's remember to try to do that at a distance so that we might transfer the groceries, but not transfer germs through droplets from sneezing and coughing. Social distancing is extremely important, and there's no way to overstate that right now. If we keep people separated, then that greatly reduces the chance that this virus will travel from one person to another. And the extremes that we're talking about seem almost unnatural because we're such social creatures. We enjoy getting together. We need to get together from time to time. But because of this situation we're dealing with, and because we don't have an antibiotic that cures the problem, we don't have a vaccine, separating people through social distancing is something we've all got to practice. It means sacrificing in some cases. Yesterday, a large number of worship houses decided not to hold services, and I applaud them for taking that stance. That helps to save lives. We need to go a step further. We need to even think about the grieving process and consider the risk involved when we hold funeral services, weddings. All of those things need to be considered, because all of those are opportunities for people to get together in crowds and to pass these germs on from one to another. If we'll all work together, we can do an awful lot to contain this virus and to avoid transmission and to save lives. And let's bear in mind that this is hitting the elderly folks the hardest, along with those who have pre-existing medical conditions such as lung disease, severe heart disease, kidney disease, and immunocompromising conditions. There's only so much that those folks can do for themselves. It's up to us to do the rest. Hand washing, covering your face, covering your mouth when you cough or sneeze with a tissue, discarding the tissue. Those are things that you've heard over and over again, but you can't say them too much. Those really do help as well. We appreciate everything that everyone is doing. We appreciate your patience. We know that everyone wants this fixed now, and we do too. We're working hard to try to make that happen. I do have to excuse myself very soon. I could take a question now, or you can reach me at the district office if you would like to call with a question.
Thank you, Dr. Riz. Chris Cohilas, Chairman of the Daugherty County Board of Commissioners. Let me just say this. This is a very fluid process, and I want to give an update from the county perspective and from the Emergency Management Agency perspective. Last Friday, consistent with actions taken across the state and in other states, I declared a state of emergency relative to public health for purposes of us standing up our Emergency Management Agency. I want to start first by thanking each of the members that are here, the ones that even aren't traditionally a member of the Emergency Management Agency, but that exist within our healthcare industry. I want to thank Phoebe Putney Memorial Hospital. I want to thank Public Health. I want to thank Dr. Ruiz and our partners at the state level and at the federal level. This is a very unique process. This is a unique emergency. And what I can say from the perspective as an elected official is this: Daugherty County is unique right now. It is seeing a significant concentration of the number of COVID-19 cases here in this community as compared to many other communities across the state. And I say that, and I'm not saying that willy-nilly. I'm saying that based upon some informed discussions that I've had with state, federal, and local leaders. We do have a significant number of COVID-19 cases that have occurred, that have been identified, some that are suspected. Those numbers are likely to go up. But I say that not to cause fear, not to cause panic, but rather to punctuate the need for each of our citizens to continue to follow the learned advice of the public health professionals and medical professionals that are talking about things such as social distancing, hygiene, and just common sense. It is very important. This is, though we know that this is not, it is not always a deadly disease, it does possess that capability. What is unique about it is that it is remarkably infectious, remarkably contagious, and that's what distinguishes it from so many other types of emergencies and disease processes. So we have to be very, very, very vigilant so that the community knows and understands what we are doing as elected leaders for purposes of advocating for our community. We are in constant contact with our state, local, and federal partners. We are making them aware of the data that we receive so that they understand what our needs are relative to testing, relative to resources, and relative to what is going on. This is a process that will be dynamic. It will change over time, and hopefully if we exercise the vigilance and the discipline that we need to, and that our professionals are telling us and asking us to exercise, then we can wash our hands, so to speak, of this whole process, hopefully sometime soon. But I do emphasize, we do, like there is a significant presence of COVID-19 that is within the community. I'm not saying that to cause panic. I'm saying that to encourage vigilance. And the actions that have been taken at the county government level in conjunction with our great partners at the City of Albany, it has been consistent with that of those of other agencies across the state. I issued a state of emergency on Friday of last week. You also saw the governor issue a state of emergency. You saw the court system. The Supreme Court Chief Justice also issued a declaration of emergency. This is a real and dynamic process. And I also want to say this. We have a task force of partners that are working on this process. It's going to have healthcare impacts. It's going to have economic impacts. It's going to have, obviously, social, political, relational impacts across the entire community. When you're talking about people social distancing or perhaps not going into work as often, all of those different areas are affected. And I say this from the perspective as a business owner. Today, we kept all of our workers home so that we could, as a private business, assess what the overall threat level was so that we could establish protocols within our business so that perhaps we can continue to operate, but that we do that in a safe and vigilant fashion so that we make sure that we have policies in place if someone is not feeling well, that we have a protocol that they have to go through before they come in. We make sure that our employees have to go through a checklist before they come into the office, because we have to think not just of ourselves, but of the people that we affect. And that's a very, very important message for us to continue to take to heart. And I recognize that we have many folks here from different agencies and different perspectives, and we all work in a social world, and the reality is we're going to have to back that back to a certain extent in order to meet the needs of our fellow citizens, our fellow neighbors, brothers, sisters, church members, congregation members, all of those things. And while in times of need it's a natural human response to want to be with each other, that is not necessarily what is the best for this community at this time. So with that being said, I'm going to turn things back over to Dr. Kitchens so that we can get more updates from the medical field. Thank you.
Hearing the chairman reminded me, I wanted to say one thing about the cooperative effort in the community, and just a word or two about what public health is also doing. We have supplied, we've shared some of our resources with Phoebe Putney, and we're glad to do so. It's a two-way street. They help us and we help them, as well as other organizations in the community. But for instance, we have shared 600 surgical masks with Phoebe, 4 dozen face shields, and 24 gallons of chemical that they can use to fog rooms and ambulances. A mobile surge field hospital has been delivered and can be used if it's necessary. I just got word an hour or so ago that the strategic national stockpile, a portion of that is set to be released today, and we're hoping that some of those supplies will be here in Dougherty County, we're hoping within 24 hours. So there's a cooperative effort going on, and we're confident that more resources are coming our way. I thank you.
Good afternoon. My name is Scott Steiner. It's my privilege to be the president and CEO for Phoebe Putney Health System. While I stand before you today, what I try to do best is to represent the more than 5,000 incredible caregivers, employees, doctors, and others that serve our system. And these are, why they're incredible is because when things like this occur, they run to, these are people that run to harm, run to the screams, and don't run away. And we also know that there's certainly the Phoebe family here working on this, but we have other healthcare partners in the community that maybe aren't directly associated with Phoebe, but like Dr. Ruiz and many of our other private doctors who are absolutely working nonstop to care for our communities. So I wanted to give you some, these are results as of this morning. Right now, Phoebe Putney Memorial Hospital here in Albany has performed 99, or has taken 99 samples from patients who have screened one way or the other for appropriate for testing. 5 patients that are in the hospital have come back as positive for the COVID-19 virus. 3 patients at home have tested positive as well. So again, depending on the condition, the severity, you can recover and treat this at home. And we've had 2 come back negative, two of those tests. That leaves us 89 that are still pending. We are seeing that the results are taking somewhere between 4 to, we're waiting on some now, 5 days. We're not sure when they'll be back. We continue to call the LabCorp for that. We believe they are inundated with requests. So we are 58 of those 89 are in the hospital, and 31 of those patients are at home. Today, we also we worked over the weekend to stand up an outpatient call line, and that number for anyone that is home that feels like they have a symptom of a fever, of a sort of a cough or shortness of breath can call. We'll do an assessment over the phone. We have more than 8 nurses right now answering that phone line. That started this morning at 9 o'clock. That number is 229-312-1919. They're able to be assessed over the phone, and if assessed, during that assessment it sounds like they need to be tested, they'll be given a unique ID number. And at noon today we started, so just about a little more than an hour ago, we started at noon today over on 13th Avenue, a drive-through site where people can be, swabs and samples can be obtained. Again, that is not open to just anyone to drive up. You need to have called that number and had to have gotten a unique appointment and number to get that testing. We currently, throughout our system, have about 1,800 testing kits available to us. We are unsure when we will get more of those, so we want to use those 1,800 kits judiciously. We have also, with the impact that we've seen for the schools, today we opened what we're calling the Phoebe Kids Camp at our HealthWorks facility here in Albany. We worked over the weekend to, we not only close the facility, which is a normal exercise facility, but we sterilized it, if you will, over the weekend and disinfected everything. And we've got more than 200 kids that will be coming, that came this morning. It's open from 6:30 a.m. to 7:30 a.m. only for Phoebe employees. And we know there's others in the community that are struggling with child care, but this is an effort for us to be able to get our workers into, to not have to stay home with their children to work in the hospital, because we so desperately need them. Happy to take questions at the end, but I'll turn it over to Dr. Kitchen.
Thank you, and good afternoon. As Chairman Cohilas referenced, and as Mr. Steiner referenced, we have certainly, over the last week, particularly over the last several days, noticed that there is significant transmission of COVID-19 within our community, and that certainly has been manifested by the influx of patients that we have seen coming in to our facility with the typical signs and symptoms of COVID-19. I want to reemphasize again, these symptoms are non-specific, and what I mean by that is they are not unique to COVID-19. They're very similar to the typical signs and symptoms that you see with the flu, with influenza, and certain other respiratory illnesses as well. But that being said, certainly what we have witnessed is that we have had many patients who have been hospitalized at this point with signs and symptoms who are really under investigation, or patients under investigation for COVID-19 at this point. And so I think in accordance with all the guidelines from the CDC, infection control, and so forth, what we have done is attempted to make sure that we are cohorting those patients in specific physical locations within our hospital, whether it be a specific intensive care unit or one of our general medical units as well. We do anticipate that we're probably going to have a large number of test results that return today. We did not have any test results that returned yesterday, and just looking at the numbers of patients who have been tested, I fully anticipate that probably sometime this afternoon we'll be able to refresh the numbers that we have. I fully anticipate that the number of positive COVID-19 patients is going to continue to rise at this point. I will tell you that I'm really privileged to work for the organization that I represent today, and I truly believe, the soul of an institution is really not tested during times of comfort. It's really tested in times of challenge and adversity. And I draw great inspiration from the dedicated professionals, the physicians, the nurses, the respiratory therapists, the pharmacists, who are truly on the front lines of this. And they represent what I refer to as the sharp end of healthcare. So as I make rounds through our intensive care units, as I make rounds through our general medical units, there's one term that comes to mind. That is teamwork. It is embodied by the professionals that we see. And so I think with the challenge that are faced in terms of making sure we're protecting patients, protecting our staff, using the personal protective equipment and that sort of thing, I will tell you that spirits remain exceedingly high at this point, and I just want to know that the actions that are embodied in our workforce are truly exemplary in terms of what can be provided by a community hospital that really rallies together in times like this. We had a special called meeting of our medical staff yesterday afternoon, who we work in close partnership with, and again, I think just a tremendous spirit of cooperation with our medical staff in terms of, even if they're being deployed in roles that may not be what they do every day, they stand up and they are willing to fully participate in this. So again, I think, acknowledging that this can be taxing on healthcare facilities and hospitals, not only from the standpoint of staff, but equipment and that sort of thing. I still, we are still very, very well positioned and poised to meet the needs of patients and the needs of the community at this point. So, Dr. Black, if you could update us on kind of what's been going on in our emergency room and urgent care centers.
Good afternoon. I want to start off by thanking everyone. I am, can't say I'm surprised, but I'm very pleased at the level of cooperation that we've had from concerned patients, family members, citizens at large. We have fielded a large amount of questions, and the questions come from a standpoint of really education, taking the time to research this ongoing epidemic. And then we're posed with questions that are well thought out. We provide advice, and those things have been adhered to. What I have been very pleased with is at the point of service in the emergency department, when patients present, they're very upfront about their concerns and about the risks. That allows us to take appropriate action on the front end. When we have discussions about whether testing is appropriate or not at this time, it's not met with fear or anger or why aren't you testing me? I have to date, and I've had the pleasure of working over the last several days. I've not had one single person after discussion and explanation of why a test is not appropriate at this time, question or argue the point. And I think that comes from a standpoint of people are taking the time to educate themselves about various information that's available to us. So I am very encouraged by the level of participation by the citizens of our community. That has made our job much, much easier. If you can imagine the widespread panic, if everyone in Southwest Georgia felt they needed to be tested or descended upon the hospital, it would make it nearly impossible for us to care for the community at large. So again, the response to this kind of worldwide pandemic, it's our ability to mitigate and treat is only possible through cooperation by everybody in the community. So I do want to thank you for that. As Dr. Kitchens has alluded to, we do have several people that are presented to the emergency department for concerns, as well as the normal ongoing chest pain, shortness of breath, things that we normally treat on a day-to-day basis. What you can expect when you get to the emergency department, we will ask you a series of questions to determine your level of risk. And if you are not high risk or if you have no symptoms, you can expect that you will not be tested at that time. We will also provide you with information for you to use at home, things for you to self-monitor your condition of you and your loved ones, and also things that you can do as far as social distancing, but also distancing yourself from household members, and things you can do for not sharing certain items. So we'll provide you with that information. And again, all of that is designed to help us respond as a community. We continue to have large numbers of people with concern, and we are evaluating those patients and treating them appropriately. There may be cases, and there have been and will continue to be times we think you are sufficiently at risk or have symptoms that lend itself to testing, but not everyone that gets tested will be admitted to the hospital. You will be given information. You may return to your home and you will self-monitor, and if your condition worsens and warrants that, then certainly we will see you back either at your primary care or at the hospital and determine the next steps of action. So we do appreciate, again, I want to thank everyone for your ongoing help and support. We will continue to provide as much information and guidance as we need to, and I thank you again.
Thank you, Dr. Black, and Dr. Kitchen. I want to pause for a moment and recognize Mayor Bo Durrell is here, and also our head of our EMS, Mr. Sam Allen. Thank you for joining us today. I want to make a few other comments before we open up for questions. And the chairman spoke to this a bit a moment ago. The main purpose of opening the Emergency Operations Center is to assure coordination between the various entities within the community, which includes information sharing, press conferences, meetings, etc. In addition, by coordinating with various community entities and having the latest information, we will reduce the number of people calling 911 to ask various questions, such as how do I get a ride to my doctor's appointment, or how do I get tested for COVID-19? And also, we can dispel the latest rumor or misleading gossip that may be circulating in the community. And having a resource to field some of those questions is very, very important. Also, it's important to know, too, when to dial 911 for emergencies. You should call 911 if you're having difficulty breathing or choking, have an allergic reaction, have symptoms of a heart attack or stroke, if you are confused or disoriented or dizzy, you have difficulty speaking, walking, or seeing, or have sudden severe pain. Those are reasons, some reasons to call 911. You do not call 911 if you want information about COVID-19. You want to get tested or have mild symptoms. Of course, you should call your doctor if for mild symptoms like a fever, shortness of breath, or a cough. So the EOC itself, the EOC number, the Emergency Operations Center number is 229-302-1900. It will be staffed from 8 a.m. to 5 p.m. Monday through Friday initially. We will be in a position to route our callers toward various hotlines, such as the one set up by Phoebe Putnam Memorial Hospital and other agencies throughout the community. Also, I'll finish here, the initiation of the task force that the chairman mentioned. The task force will be operating for the most part in a virtual environment, utilizing conference calls and small meetings if necessary. This will assure all of our emergency support functions are meeting regularly and communicating resource needs just as they would if we were all housed together at the EOC, which would normally be the case if this were in a different type of emergency, such as a hurricane, flood, or tornado. So it's going to be critical that we interact with our partners, both from an economic standpoint. We're also bringing the chamber on board to be a part of this as well, to engage our business community. So we're excited about that. We will also be sending out briefings. One started today. There'll be, it'll will be termed a press release. You'll be probably receiving that from Wendy Howell or Phyllis Banks. You'll see that information start to flow out. It could be one in the morning and one in the evening, depending on the amount of information that's developed during the day. So we're trying to keep our community informed, keep you informed so that you can share it with our citizens. With that, I'd like to open up for any questions that you may have of any of our panelists today. Questions from the media? Okay. Well, thank you very much for being here. And at this point, we will close our press conference. Thank you.
Thanks, Chief.
Yes, sir. Thank you very much. Appreciate what you do, too.